morning. Welcome to day 87 at Quantum's Liberty. Hope this day is finding you well. Let's go, birdies, and some water. Today on the phone, we have Jeremy. He's with us again. His family is in critical care medicine. He's 16 from North Dakota. And the reason that we have Jeremy with us again today is because he has very good news for all of us from North Dakota. So we had an upsurge. We're going to be tapping. It's a DeStress series. Start tapping on the karate chop point. It's a DeStress series, and it is designed to help us to lower our cortisol levels and to raise our immunoglobulin levels during the pandemic. We know that in 1 week of tapping and meditation that we can lower our cortisol levels 37% in just 1 week, and also raise our immunoglobulin levels 113%, in particular the IgAs of the respiratory tract. So we like to do that. Also, tapping helps to bring a number of neurotransmitters and hormones online, which will help us to feel better. And also, what tapping on this 5,000-year-old meridian endpoint does is it slows down the firing that goes from the amygdala, that goes, the neurons firing to the amygdala, and that in turn helps to slow down the release of adrenaline and cortisol going into our body. So we know this from science, biomarkers, and from many different research studies that are being done on EFT and the profound effects, that's called emotional freedom technique or tapping, the profound effects that it has both on the subjective and the objective body-mind system. So we are doing a DeStress series, and that is to help us get through to about the mid-February range, when some of our science says that the pandemic, we really need to buckle down and take care of wearing masks and social distancing, and doing some really big measures that we can each take responsibility for. And one of the things that we can also do is we can help to lower our cortisol levels and to increase the immunoglobulin levels. But the tapping in slowing down the firing to the amygdala, which is our stress response, we can see the news and hear the news. And then we can also, because those firing signals to run from the news are not happening because we're tapping, the images and the things that we hear are filtered somewhat. And so we have a calmer filter with which to look at it. And the way that this is seen in science is that the oxygen, instead of going to the arms and legs to run from danger, it stays in our prefrontal cortex. When we have a fight-flight response, then the neurons fire to the amygdala, are saying, run, run. Another thing that happens within 1 second, and it usually takes us about 14 seconds to realize that we've been triggered, but in 1 second time, all of a sudden these hormones and neurotransmitters are set free into our body brain. And we also have a tightening of the capillaries in our prefrontal cortex area, 70%. So if we have a tightening that severe in the prefrontal cortex, that means that much less oxygen is getting to our awareness center, where we can think about what needs to be done next. So when we're tapping on this point and we listen to the news, and that's the point of this DeStress series, is we're going to talk about the news, but we're going to tap at the same time so that we can hear the news, but our capillaries will remain with that nice open flowing oxygen there, so that we can really do and think the next best thing to do during the pandemic. So that's what we're doing. So today's day 86, and Jeremy is with us again because we have some really good news out of North Dakota. We've been talking about how, so his parents are in critical care medicine, and that in North Dakota, the hospitals were being overwhelmed. And they were trying to send people to other hospitals nearby, but those hospitals were also full too. So people were getting shipped like 500 miles away. And so the thing that we talked about was that the policymakers were not informed maybe clearly enough, right? And maybe the situation, unfortunately, the situation did get really out of control there. But the good thing is that the policymaker, the governor, did yesterday close down all the businesses, the schools, and has ordered a mask mandate, which is exactly what the health professionals were trying to ask him to do, so that they could have a reduction in a number of people that were going to the hospital, and then they'd be able to take care of the people who were sick in their state, instead of having to ship them to another state like 500 miles away. So we just wanted to talk about that because that was so overwhelmingly good news to hear that the North Dakota, the governor is listening to the health officials. Now, there was another story that came out, and this one was from NPR, and also CNN and Washington Post reported on it. And it was that Stanford University Medical Center has said that they are distancing themselves from a public health official who is fairly newly on board the White House task force. And his name is Dr. Scott Atlas. And so Stanford wrote and said and presented they said word for word, Dr. Atlas's pandemic approach is inconsistent with the university's approach to the pandemic, and to really strictly adhere to the directions of the public health officials and the experts. So apparently Dr. Scott Atlas told Michigan to fight against any restrictions during the pandemic. I guess he said rise up against the public health officials. So Stanford put out that saying yesterday that they are not in congruence with what Dr. Scott Atlas is saying to do, to not wear a mask. But Stanford says definitely do wear mask. We support wearing masks strictly, and also strictly adhering to social distancing. So let's continue to listen to the science. Critical care medicine, like I took an 8-hour course, and so in the ICU, we're wearing masks and we're wearing full protective equipment to take care of these people. So I'd like you to know that the staff of the Washington Post reported that it took 100 days for us to get to 1 million cases, but last week it took us 6 days to get 1 million cases. So we went from 10 million to 11 million last week in 6 days, and it took us 100 days to get to 1 million cases before. So now it's only taking us 6 days. So what we're doing is we're going to listen to the public health guidelines, um, and uh, and we're definitely going to wear masks because that's what we're doing in critical care medicine, and that's what we were told to do in an 8-hour class a couple weeks ago. So let's continue our tapping. And Jeremy, we want to tap on. We're going to tap on health. All right, so let's envision ourselves in the radiant, lovely, beautiful health. Close your eyes and picture yourself running and jumping and skipping and having a great time playing games and skateboarding with your friends. And Jeremy, if you find, or if you are listening in, I'd like you to just tune in and to your body and see if there's any place in your body that is saying, "Oh, I can't have that radiant health." Right? Just imagine yourself in this beautiful bliss, and then if there's anywhere in your body that says, "Nah, can't have that," just hone in on that, because we're gonna tap on that. This is like a psychological reversal point on the karate chop point. So we're gonna tap on that. We're gonna focus in on it, and then we're gonna tap on envisioning radiant health for the pandemic, for the COVID-19 pandemic, with or without it in the environment. So let's get through this together. We're gonna make history here, right? So tapping, open your eyes, nice deep breath. And you've got like where that is, any resistance to the beautiful health, where it is in your body, and give it a number from 0 to 10, where 10 is the most resistant you could ever have to this beautiful vision of radiant health. And 0 is no resistance at all. You're like full on there. All right, so we're tapping. And then repeat after me 3 times. This is going to be the setup statement where we put the problem in the box and we say, even though I have this problem here, I deeply and completely love and accept myself. So we do that 3 times and we tap on the karate chop point. And that's transformative. All right, here we go. Even though, repeat after me. Great, Jeremy knows the points. Even though I have this resistance to radiant health, I deeply and completely honor and love myself exactly as I am. Karate chop point. Even though I have this resistance to radiant health inside of me, for whatever reason, it's there. I'm looking right at it. I see the resistance and I feel it. And even though it's there, I honor myself exactly as I am. And I accept all of me. Even though I have this resistance inside of me to radiant health, I deeply and completely honor and trust everything inside of me, and I accept myself exactly as I am. This resistance to radiant health, this resistance to having all this radiant health, lights went on, this resistance to radiant health, I am me with this resistance. I am me without this resistance. Whether or not I have this resistance, I'm honing in on it. I love myself completely. With or without this resistance inside of me, I feel it. It's kind of scary. Instead of looking at it, I think I'll run from it. I don't like seeing it. Wait a minute. I can have this. I accept all of me. I deserve radiant health. I deserve this radiant health. I see myself in radiant health. I am that person with radiant health. I am in radiant health. I walk and talk in radiant health. My neurochemistry is flooding me with wonderful neurotransmitters and hormones. This effect is proven by science. Oxytocin unlocks 2 neurotransmitters, such as nitric oxide, which keeps the blood vessels in my prefrontal cortex open. This is my awake center, where I can choose the next best thing to do. I can do the right thing in the pandemic. Science says wearing a mask is effective. So is social distancing. So is washing my hands for 20 seconds with soap. And the other neurotransmitter that's unlocked with oxytocin is called anandamide. This is your bliss hormone. Not only am I reducing cortisol levels in 1 week of tapping, but I'm also helping myself to feel better. Like way better. I see myself in radiant health. I see that image. I am that radiant person. I am walking with radiant health. Collarbone, I am talking with radiant health. Under the arm, I am walking with radiant health. I am thinking with radiant health in mind, body, and spirit. So excited for you, Jeremy, and for your family. Really happy. Thanks for sharing the good news about the North Dakota governor. Yeah, keep on up, being a light for others. You got this. We're making history. Bye.